2, 1.
Hello, everyone, and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Donna Rodriguez. I'm going to be filling in just for the very opening of today's show for Steve Triffletti. He'll be joining us in just a couple of minutes. This forum is number 99. We are very excited to be able to bring this information about COVID and about our communities to all of you each and every week. It's being brought to you live by PAC TV on Comcast Channel 15 and Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today, our participants include Ken Tavares, the immediate past chair of the Plymouth Select Board, Philip Triffletti, MD and attending physician at Beth Israel Deaconess, Dr. Barry Potfin, Professor Emeritus at Yeshiva University Department of Biology, as well as with the Plymouth Board of Health, and Amy Naples, our Executive Director of the Plymouth Area Chamber of Commerce, and Matt Muratore, our State Representative. We're going to be opening today with Ken Tavares. And Ken, thank you so much for being here with us today. Thank you for having me to open, and Steve will be back with us in just a moment.
Thank you, and good afternoon, everyone. A year ago, and actually a little over a year ago, we discussed a book that had just come out, and it was titled "And the People Stayed Home" by Kitty O'Meara. And I am going to take my opening thoughts today from Kitty's book. When the book came out, she offered us wisdom that has certainly helped us during the COVID pandemic and beyond. Now she is challenging us to grow, to look inside, to listen deeply, to allow ourselves to think differently, and ultimately to create new ways of living on this great planet. We've all changed one way or another, whether we want to admit it or not. Our actions will determine what kind of legacy we will leave future generations. We now have much work to do. Let's begin this journey with peace, compromise, and tolerance. Thank you.
The immediate past chair of the Plymouth Select Board, Ken, will be here to answer your questions with our panel. You can send your questions to plymouthinfo@pactv.org. And I also want to thank Donna Rodriguez here while I temporarily was floor manager. She has now continued to stay here in the studio, and thank you for hosting last week. At this time, we're going to move right to our medical segment, and we welcome back Dr. Philip Triffletti. He is again an attending primary care physician at Beth Israel Deaconess. Welcome, Phil.
Good afternoon, Stephen. Thanks again for having me on the show. I'm going to jump in today and talk about some of the news about at the federal government level regarding the COVID-19 guidelines, and start with the CDC recommendations. A couple weeks ago, the CDC said we didn't need to wear masks outdoors. That makes a lot of sense, very easy to digest. But then last Thursday, they came out with a really surprising announcement that for people who are fully vaccinated, they would not need to wear masks indoors. And so that's very exciting news. And I think, the main purpose of this from the CDC really, I think, is just to build confidence in people who have received the vaccine, build your confidence in how effective it is and how well protected you are. And I think a secondary motivation from the CDC really was to create more incentive for people who are not vaccinated to get vaccinated, letting them know really that, people who are fully vaccinated, they're not at much risk if they're indoors doing activities with others, but it's the people who are not vaccinated, they're putting themselves at more risk. If they go ahead and get a vaccine, they can greatly reduce their own risk. So, I think that's really what was behind the CDC. Obviously, it's probably complicated for most people to understand the difference maybe between the CDC, the NIH, government authorities, Department of Health and Human Services, and public health departments, et cetera, et cetera. They all have different roles. The CDC's role really is, they're a scientific advisory and they create guidelines. So they're not creating policy at the government level. but they do advise us of what to do. So I think a lot of people get perplexed when they hear advice and then they don't understand necessarily how that's going to be implemented in the communities where people live. So obviously, how that's going to be implemented here in the state of Massachusetts, Governor Baker announced, as of May 29th, I think there would be no longer, any requirements to, use the masks for the fully vaccinated people, starting at that time. So we're making great progress. I think you'll hear from others on the panel today about the great progress, the drops that we're seeing in terms of active cases. And of course, that helps reduce hospitalizations and deaths, the whole thing. And we continue to increase the number of people vaccinated in the state of Massachusetts. And we're doing well here in the United States. And, I'm delighted to see that, the U.S. will be reaching out globally, with President Biden's leadership, to try to help others around the globe, where it's much needed to have that help. But, we're doing extremely, extremely well right now with the pandemic, with the numbers dropping of new cases every day. One thing I would caution about, just to keep in mind that for those of us that are very healthy and we're fully vaccinated, it's safe to be around others without a mask. I think there are some of us who have health conditions where they might not be as protected. Those really with severely impaired immune systems. So, some of the studies have indicated that if you have a serious bone marrow problem like leukemia or more advanced lymphoma, these people, their immune systems don't work as well. And when we study how well do they get an antibody response from the vaccines, they either don't get a good response, probably in bone marrow transplant patients, or the responses are not as good as it would be in a healthy person. It might be half as good, maybe 50% protected as opposed to 95% protected. So just keep that in mind, that if you have any vulnerable friends or family, or if you're vulnerable yourself, you may have to take still extra precautions. The need to do away with the masks in the indoors, there are some exceptions still. So that includes healthcare facilities. So, where I work in a doctor's office, I'm still going to wear masks with my patients, and patients will still wear masks when they come in here. Even if they're fully vaccinated, they still want you to wear masks for public transportation, in some congregate settings like prisons, nursing homes, et cetera. So there will still be a few pockets where we'll still be recommending masks for those that are fully vaccinated, but not everywhere. So I'm going to stop there because I don't want to take up too much time in the show, but I'm happy to answer any questions at the end of the broadcast. Thank you for having me again, Steve.
Thank you, and that's Dr. Philip Triffletti, an attending primary care physician, Beth Israel Deaconess. You can send your questions to PlymouthInfo@pactv.org. And at this time, we continue our medical segment, and we welcome Dr. Barry Potfin. He is Professor Emeritus, Yeshiva University, Department of Biology. He's an epidemiologist. Welcome, Barry.
Hi, Steve. Thanks for having me again, and congratulations on the new addition to your family. I have a lot of information to provide. I'll try to do it again as efficiently as I possibly can. So let me start the screen share for you. I'm getting better at this as time goes on, so I think I can do a better job now. So let me first show you what's been going on with the data. We'll just drop down to the bottom of this slide. And you can see that for the first time in an awful long time, Plymouth has now gone from red to yellow all the way down to green. So what that means is that Plymouth is now categorized as a low risk for transmission. That's because this number here, which is 7.7, is below 10. And I fully expect that we'll probably stay in that category for some time because the numbers we see on a daily basis are staying quite low. Graphically, this is again the presentation of what's been happening. I won't go through it, but it's all very reassuring. This is the kind of thing that's been happening across the Commonwealth. And again, you can see that the number of these red high-risk communities continues to drop and is now all the way down to 6. This is the data that I collected last night. And you can still see that numbers are still going up. They're going up much more slowly than they had in the past. And that's true generally for the US and for Massachusetts and for Plymouth as well. This is what's going on with vaccination sites. So I'll give you the vaccination data for Plymouth in a moment, but there's a few things I wanted to point out here. One is that remember that most of these mass vaccination sites, at least 4 of them, are being closed eventually towards the end of June. I just received word about an hour ago from the people that run the Colony Place BID Plymouth site that they are going to be closing that to all new walk-ins after this Friday. They had reduced the hours for this week. It was only open for walk-ins on Monday, Wednesday, and Friday, I think from 8 or 9 in the morning until 3 in the afternoon, with the exception of lunch times. But after this week, they will only be open for people who make appointments for second vaccinations. The other news is that, and I just saw this yesterday, apparently the State Department of Public Health has finally, and I use finally with several exclamation points after it, approved the Kingston collection site that we proposed as a regional walk-in site. They approved it on May 18th. And the details are not available yet because we don't know exactly how it's going to be run, how it's going to be managed, and the dates or anything. And I wish it had happened months ago, but they finally did it. And so there'll be more information coming out about that shortly. These are our vaccination data, which came out last Thursday. So there'll be new data available this coming Thursday, tomorrow. You can see down at the bottom that 57% or so of our Plymouth residents are now vaccinated with at least 1 dose of the vaccine, and 44% are considered fully vaccinated. The numbers otherwise are growing. The numbers that you see for the older groups are growing very slowly because they're already very, very high for vaccination rate. The 50 to 64-year age group have also been growing, as has the others. But we're running now into a slowdown for demand for vaccines because we've probably vaccinated an awful lot of the people who really anxiously wanted to get vaccinated and spent hours on the computer trying to get appointments. They now probably just about all have been vaccinated. So this is changing. The state has about 60% that have at least 1 dose also. So we're probably pretty close to the state rate. These are all the new regulations that came out, and I wanted to go through it with you. So I'll do it as quickly as I can. The face ordering from the Commonwealth has been rescinded effective May 29th. They're going to issue new face covering advisories consistent with the CDC updated guidance. Face coverings are still required for all individuals, regardless of your vaccination status, on public and private transportation. That includes ride shares, livery, taxi, ferries, MBTA, commuter rail, transportation services, also in healthcare facilities and providers, also for congregate care settings, and any health and rehabilitative day services. You probably also know that it's still really required if you're traveling by plane. I'm pretty sure they're still going to require it in airports, and they're probably still going to require it on airplanes, except when you're eating or drinking. Non-vaccinated individuals are advised to continue wearing face masks, continuing distancing in most settings. The advisory is going to recommend that fully vaccinated individuals no longer need to wear a face covering or social distance indoors or outdoors, except in certain circumstances and situations. So this has changed rapidly. Keep in mind, please, that you may still see people who are fully vaccinated that continue to wear masks just because they feel it's a safety precaution that they don't want to give up. Employers can require you to provide medical documentation of vaccination status. and they can require you to continue to wear face masks. They're also allowed to set their own safety guidelines. Doesn't matter whether it's a private employer or a government employer. It apparently covers everybody. Effective on May 29th, all industries will be permitted to open, with the exception of remaining face covering requirements. All industry restrictions are going to be lifted. Capacity is going to increase to 100% for all industries, and the gathering limits are also going to be rescinded. So basically, almost everything is going away on May 29th. Originally, that was going to be August 1st. So the governor and his advisory panel decided to move it way up by obviously more than a month. So all of that's new stuff. Some other things have happened as well. On May 18th, the youth and amateur sports guidance has actually been updated. No longer requires face covering for youth athletes 18 and under while playing outdoor sports. And on the 29th, all youth and amateur sports restrictions are going to be lifted. On May 18th is guidance from DESE and Department of Early Education and Care, which is going to get updated to no longer require masks for outdoor activities like recess, and to allow for sharing of objects in classrooms in both K-12 and child care settings. The guidance will remain in effect beyond May 29th. Keep in mind that these things are not taking effect until May 29th in most cases. The administration released updated guidance for summer camps just 2 days ago. And the main thing is keeping in mind children under the age of 12 can't yet receive the vaccine, but effective on the 29th, fully vaccinated individuals do not need to wear masks indoors or outdoors. They don't need to socially distance while they're at camps, and they do not need to quarantine after exposure unless symptoms develop. So there's a lot more to it than this, but I don't have time to go through it all. And Governor Baker stated that he will end the state of emergency for the Commonwealth on June 15th. So that's all I'm going to show you for today. I'll be happy to answer questions and try to help out with anything else I can at the end of the show. Thanks, Steve.
Thank you. And we do have questions from a viewer. You can send your questions to info@pectv.org. And at this time, we're going to welcome back on our business segment, Amy Naples. She is the Executive Director for the Plymouth Area Chamber of Commerce. Welcome back, Amy.
Yeah. You would think I already got this down by Pat, but I guess not. Well, it has certainly been a week, hasn't it? The weather is beautiful. The downtown waterfront are vibrant, and businesses are starting to see an uptick in business. And I would say the icing on the cake is certainly the governor's announcement. We are obviously so excited, relieved, and feeling pretty good about how this impacts our local economy. As I mentioned previously, the Chamber has been planning in-person events cautiously and slowly. Yet, since the announcement, we've hit the gas pedal and planning some of our larger scaled events as well. So with that being said, I'm very excited to announce we'll be hosting our annual Waterfront Festival on August 28th. Our phones have been off the hook from vendors inquiring, so no doubt it's going to be a great event. We are, of course, taking extra precautions, spacing things out, working on the details with Plymouth Police and ensuring that safety is paramount for both participants and attendees. So with that being said, we're super excited. We're working on that as well as Bark in the Park Festival, date to be determined. And then of course, all of our larger scaled networking events, expos, and others. We were very excited also to hear from Matt Tavares last night at the select board meeting about the 4th of July committee and how they are working to pull off a celebration for us. And of course, we stand ready to help however we can. And I think we'll be seeing a lot of that. So a full calendar is upon us, which we are so excited about. And of course, the Chamber networking calendar is filling up and has filled up for June. So we have planned out in-person events for our networking lunch, net walking, cash mob, and business after hours. So for a complete list and schedule, visit plymouthchamber.com. And of course, follow us on Facebook and Instagram, or reach out to us to be added to our email list. And to move on to some recovery efforts that the Chamber is working on, in an effort to help our businesses with some of the employment challenges, we put together a virtual job fair that's actually taking place right now during this program. It was from 10 to 1 today. It is presented by Mass Hire in partnership with the Plymouth Area Chamber, our Recovery Task Force, the Pembroke Chamber, the South Shore Chamber, and the South Shore Young Professionals. We have 96 participating employers covering over 16 industries, and that equates over 900 vacancies. So I just want to mention, if you were unable to attend this virtual fair, certainly reach out to me. I'm happy to connect you with an employer or with Mass Hire that you are interested in, but we certainly want to make those connections. In addition, this coming Saturday, May 22nd, from 12 to 3 at Hilltop Athletic Association in Kingston, there'll be an in-person job fair. This is presented by our amazing legislative delegation, including our very own Rep. Muratore, Lenatra, Cutler, Zaros, and Senator Moran. So this is a great opportunity for job seekers to meet one-on-one with our local businesses. We encourage you to get a leg up on these opportunities because there are so many available, and great rewarding careers are kind of right here on the South Shore. So I encourage job seekers to look more into that. Certainly reach out to me if I can be of any assistance. Because this is such a huge issue, we know it's not just a local issue. It is kind of across the country, people struggling to fill these positions. And with the recent announcement from the governor stating that we can open up at full capacity, we know this is going to be our biggest hurdle and something we need to concentrate on and fill these positions. So with that being said, I'm asking folks to kind of be patient with our local business community. They're doing all they can. They're filling multiple roles. So patience is important. It may take longer to get some things, or you may have to wait in line, but they're doing the best they can. I think it's just a good reminder. In addition to that, I just want folks to be reminded that businesses do have the liberty to make their own rules. And if they have certain restrictions in place in their business, that we ask that you respect them, especially if there's mask wearing or others. Just as a reminder, our business community is working hard and is equally excited to welcome you back into their establishments. We certainly have such a great feeling about this coming season. Businesses are starting to pick up. We'll be welcoming visitors. We already are. We're seeing that on the waterfront in downtown. I think families are feeling safe and starting to explore again. And a couple of months ago, together with our partners, C Plymouth and the Plymouth Regional Economic Development Foundation, Stephen Cole, who comes on the show regularly as well, we together applied for a grant with the Mass Office of Travel and Tourism on a billboard campaign. So we're so excited. We were awarded the grant, and we were able to create a beautiful billboard campaign. And I'm not sure if we do have the picture on there, which is awesome. So here's a glimpse at one of the billboards, featuring, of course, the Chamber and the Regional Economic Development Foundations. I think this shines a beautiful light on our county, showcases the beauty, the history, and fun our community has to offer. So these will be sprinkled throughout the Commonwealth. So certainly be on the lookout. And I think this is such a great opportunity for our community to market our region. And we know these colorful billboards will certainly create some chatter and visitation. So we have lots of great things we're working on in regards to recovery efforts, and certainly in various industries. So we continue to work on those despite the wonderful announcements and lots of change. We do still have a lot of work to do, and we will be continuing to meet regularly and work on that. But it's all great things, and it is a pleasure to be on here today and report such positive news with you all. So thank you, Steve.
Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. She will be part of the panel answering your questions. Send them to PlymouthInfo@pactv.org. And each week we have a report from the state. from our state representative, Matthew Muratore. Welcome, Matt.
Hey, Steve, how you doing? Hey, congratulations too on the new grandchild.
Thank you.
Great addition to your family. Going along with what Amy had to say too, starting next Saturday, which is, as been indicated, May 29th is the opening of really the Commonwealth. There's actually going to be a craft fair down at the Hedge House that's put on by the Sunrise Rotary Club. So that's going to be a great event, and a lot of people are going to be out there Memorial Day weekend. And I heard Amy's counterpart yesterday on WATD talking about that weekend is going to be like Mardi Gras, but I think in Plymouth it's going to be Mardi Gras every day this summer with people coming out. So we're really looking forward to a good summer here in Plymouth. Just looking quickly, Steve, at some of the numbers. For the 12th straight day, we've been under 1,000 cases of COVID in the Commonwealth. The total cases since we began in March of 2020, 657,500. With unfortunately 17,420 deaths. The 7-day positivity rate is down to just hovering a little over 1%, 1.06%. And right now we're at 12,700 active cases. And as I said in the past, I think by the time we are back on our last show next week, Steve, we'll be down to a few thousand of those and still falling. The doses of vaccinations at this point, 7.2 million doses have been given here in the Commonwealth, with 4 million of those being the first dose and 3 million being the second, with 233,000 of those being the J&J. So at this point, we're at 3.25 million people fully vaccinated here in the Commonwealth. And of course, our goal is to be at 4.1 million. And we expect to hit that mark sometime in the first part of July, early part of July. As Dr. Potvin mentioned as well, the Kingston collection has been approved for a regional site, and I get people that are asking, well, do we really need that? And the reason that we do need it is because we need still more convenience. As we've talked about in the past, Steve, on the show, is that now people are looking for convenience. And when you start looking at the age groups of people that still need to be vaccinated, there are 20 to 29-year-olds, 38% of the folks have been fully vaccinated. The 30 to 39-year-olds, 50% have been vaccinated. But then when you start getting into the 50 to 64-year-olds, that's at 57%, almost 58%. 65 to 74-year-olds, or 80% of those have been fully vaccinated. And the folks who are over 75 in the Commonwealth, 88% have been fully vaccinated. So you see the younger population, the 20 to the 50 to 60-year-olds, still look, they're convenience. They're looking for convenience. And that's why, it's still important to have the Kingston collection in place. So that's the update. One more thing I do want to mention. I'm not sure. I don't think Amy mentioned this, but the House met yesterday in session. And for those businesses out there that are concerned about the unemployment rate with the solvency part of the account, the House voted yesterday to do a bond of 20-year bond and spread that over 20 years. So there's not major payments that are going to be made by businesses on June 1st for their unemployment taxes. The Senate will take it up later this week or next week. And we expect the governor will sign it before June 1st. So stay tuned for more of that. And that's the update, Steve.
Thank you. And that's Plymouth State Representative Matthew Muratore. And he's here also to answer your questions. And as he said, we'll be having our final show next week. And we have a number of people we're going to bring back in our final show. It'll be special number 100. And joining Ken and Matt and me will be our guests from today, Dr. Potvin, Dr. Triffletti, Amy Naples. Also, Timothy Cruz, the Plymouth County District Attorney, also Melissa Origi, she's the Plymouth Town Manager, Dr. Christopher Campbell, he's the Superintendent for Plymouth Public Schools, Michelle Brady, she is the Director of Elder Affairs for the Town of Plymouth, and Father John Colity from St. Mary's. At this time, we have a number of questions that have come in today, and we're going to go right to them. The first is from a viewer. And the viewer is Karen. And Karen asks, we'll ask Dr. Triffletti first, is there any information on how long the COVID virus lives on surfaces? Specifically, do we still need to clean off our groceries after we get home from the store? Dr. Triffletti.
Yes. So the information on the virus staying on surfaces, what we might refer to as inert surfaces, it doesn't seem to last very long. And we've pretty much, for many months now, we've considered the major mode of transmission is a respiratory transmission, meaning that the particles of the virus float through the air along with other mucus. If somebody's coughing or speaking or singing or yelling, that's how the virus tends to get transmitted from one person to the next. And it's very seldom probably that people are picking it up on packages, groceries, doorknobs, things like that. I think having good hand hygiene is a good principle going forward, even after we're out of the pandemic. It's good to wash your hands regularly. We touch our face a lot, so if we do get things on our hands, it does introduce the possibility of infection. But I think in terms of having to worry about wiping down items that come into your house, I don't really feel that's really necessary, probably unless you knew it was handled by somebody who was sick with COVID. Then of course you'd want to take more precautions. But I think just for the average daily life, I think focus less on that and focus more on if you're not vaccinated, to wear masks, and then the most important thing is to get fully vaccinated, so then you don't have to worry so much at all about exposures, whether they be from inert surfaces or respiratory, if you're fully vaccinated.
Thank you, Dr. Philip Triffletti, and attending primary care physician Beth Israel Deaconess. We're going to go to Dr. Barry Potfin. Dr. Potvin, a viewer asks, how is Plymouth aligning with state and federal guidelines? And in particular, are there any different rules for the town of Plymouth as compared to those being promulgated by the state and federal government?
Yes. Well, I should point out that we have the capacity, as does every community, to actually put in place stronger restrictions, but not weaker restrictions than the state does. But given what's going on in Plymouth and the low numbers and the fact that we are now a green community, I can't speak for the entire Board of Health because that's an individual decision by all 5 members. But certainly there's some discussion that goes on. I really, myself would not feel that stronger measures were really required at this particular point. But our job is to remain vigilant and to keep an eye on what's going on and make sure that we can stay a green community and our businesses can be fully open and we can all enjoy our lives. So we can, but we don't have to. And it's not an individual decision. It's a committee or a board decision.
Thank you. And that's Dr. Barry Potfin. He is the chair for the Board of Health in the town of Plymouth. Amy Naples, a question from a viewer. What is the response from our small businesses about the governor's new guidelines? And what are the biggest challenges now for businesses and how can we support them?
So certainly with the reopening announcement, there was a sense of relief. And I think business owners had reached out to me that day, celebrating, sharing with me they made it, that they survived, their doors are still open. So I think that this milestone means so much more than some may know. It's a celebration. It's a feeling of we made it, we got through this. So although much work has to be done and many, they have to continue many safety measures and all that, but I think they are in celebration. Again, they're so thrilled. As I said in my earlier report, the biggest challenge is truly hiring. So I ask you to spread the word far and wide about the employment opportunities. Encourage high school students, college students, those who are unemployed to inquire with our local businesses on employment opportunities. Many businesses are willing to hire. Many businesses are willing to hire high school students. And then finally, as I said before, be patient. Just be patient with them. They're doing the best they can. And they're trying to reopen and operate as much as they possibly can. And finally, in closing, I just want to say to my fellow panelists, you all are just remarkable and provide such amazing information. I can't believe it is the 99th show. Just a huge round of applause and congratulations goes to you, Steve, Ken, Matt, and of course, the amazing team at PAC TV. You've all dedicated so much time and work and blood, sweat, and tears, I'm sure, in this show. I, for one, am so thankful for this and the opportunity this has lent for the chamber. But I also hear all the time how helpful this show is for our community, and how many people have relied on it for reliable information from local, reputable people, and just feel a sense of comfort tuning in. So I look forward to the 100th show. It's going to be a great celebration, and I just want to extend, of course, huge congratulations to you all.
Thank you, Amy Naples. And Amy, it is true. We hear it all the time. I heard it this morning at the gym at Plymouth Fitness, someone commenting about having heard one of our medical panelists recently speak. So we're happy to do it. It's a labor of love. And we're going to go now to one of those lovers, Matt Muratore. Matt, a question. There have been reports of small businesses still needing state and federal support for economic recovery. What are the conversations, if any, at the state level?
Actually, we have Josh Cutler, representative out of Duxbury here, that is the chair of the Labor and Economic Workforce Committee at the state level. So I know they're working on a number of bills. And of course, you know, we've done a lot for the businesses over the last year, but I think more will be happening. But the biggest thing, Steve, I think is we still have $4.5 billion from the rescue fund from the federal government that we're going to be looking at for one-time fixes to help all sorts of parts of the Commonwealth, not just the economy, but all sorts of it. So as I indicated, we are helping with the solvency fund for the unemployment for businesses, but there are other things that we need to look at rather quickly, because once the emergency is lifted on June 15th, Steve, by the governor, it does away with things like giving away, not giving away, but paying for alcohol and taking alcohol to go home from restaurants. So there are things like that, things like telemedicine, telehealth that goes away. So there's a lot of things that were good that came out of this this COVID that will go away after, when the emergency ends. So we need to really look at, and we are going to start looking at what things we want to keep in place to keep the economy continuing to thrive.
Thank you, Matt Muratore. Plymouth State Representative Dr. Philip Triffletti. Viewer asks, it's confusing for those people who have children in school. Is there different guidance for families with children as to how to proceed now in the pandemic?
Thanks, Steve. So, as you're probably aware, we can now vaccinate children as young as age 12. So, of course, everybody age 12 to 18, we encourage them to get vaccinated. It will be some time, probably in the beginning of 2022, when we'll have, potentially some approvals of vaccines for age 6 months to age 12. So we don't have vaccines right now for them. I think when you think about what we're recommending with the CDC guidelines, we're saying if you're fully vaccinated and you're indoors, you no longer need to wear masks unless it's one of those exceptions like healthcare facility, traveling, public transportation, et cetera. However, I think for younger people who cannot be vaccinated at this point, they should, be wearing masks indoors as a precaution. So that's probably the main difference. Obviously, people don't have to wear masks when they're in their own household with their household members. But, if you are indoors I think still at schools, I think they'll be required. I think any setting that's indoors, you should wear your mask if you're a child.
Thank you, Dr. Philip Triffletti. And now we're going to circle back to our panel for their closing thoughts. We're going to continue now with Dr. Barry Potfin. Barry, it's been over a year. We're closing in on our last presentation. What would be a takeaway today for those people who are watching?
Yeah, it's been more than a year, and it's been difficult and kind of draining, but we got through it, and hopefully it won't be coming back. I do want to point out to everybody that you need to be understanding and don't be confrontational with people in respect to whether or not they're wearing masks. Just because someone is wearing a mask doesn't necessarily mean that they weren't vaccinated. People are going to wear masks that have been vaccinated regardless because they feel safer. Just because someone isn't wearing a mask, again, doesn't mean that they weren't vaccinated. You can't really tell, and there's no way to know. So try to be, understanding about people's personal risk tolerances. Remember also that, the vaccines are 96% effective. So there is still something called breakthrough infections, and we've seen them. So you could still contract COVID with a very small risk, but you still could, even though you're fully vaccinated. It can happen, it does happen, but when you do get infected, it's usually a mild case, which has very mild symptoms. So keep in mind that, and I'd like everybody to trust our Department of Health, trust the Board of Health. We will be watching very, very carefully, and if we have to do anything to further protect the community, we will not hesitate to do so if it's absolutely required. In the meantime, let's all go out and have fun and patronize all the businesses and go to the 4th of July celebrations. If you feel at risk, so you stay a little bit further away from others and you wear a mask. And if you feel comfortable, you don't. So it's on us. Enjoy life more now, I hope, than you have been able to for the last year. Thanks, Steve. Thank
you, Dr. Barry Potfin. We're going to go back to Dr. Philip Triffletti. Dr. Phil, you just heard Dr. Potvin. He's telling us to go out and have some fun. Would you agree? Should we go out and have fun now?
I'm all for having fun. I think that's a great idea. My main message that I want to bring forward today at the end here is, that we need to put our trust in the vaccine. And this is similar to what, Barry has been talking about here. You should trust that the vaccine is safe, trust that it's effective. I have about 300 patients or so in my medical practice. I've only had one patient come in who's reluctant to take the vaccine. She's 71 years old. She's in good health, but she's afraid of side effects. She's the only one. The CDC is tracking very closely what Barry was referring to, these breakthrough infections. There was a news report about the New York Yankees recently. They're still screening their staff, with regular PCR testing, and they found a few people got infected. So we know that this can happen because the vaccines are not 100% effective. If it's the Johnson & Johnson vaccine, which they had, it's probably even, more likely that people can get mild infections. But we know that you're not likely to be hospitalized. The CDC has only received a little over 1,000 reports out of 115 million people that have been vaccinated. They've only received about 1,000 or so reports of people being hospitalized after being vaccinated. And the deaths have only been 223 in people who have been fully vaccinated. So we know, you're not likely to get hospitalized if you've been fully vaccinated. You're very, very unlikely to die from the infection. So I would just say, if you have any leadership role, if it's in your family, if it's in your business, wherever it might be, if you know people that have not gotten their vaccine, please do whatever you can to, tell them to talk to the primary care doctor if they would trust them for the advice. But please encourage people to try to get vaccinated. I think that's the number one message. Thanks.
Thank you, Dr. Philip Triffletti. Attending primary care physician Beth Israel Deaconess. We'll go back to Amy Naples. Amy, you just heard Dr. Phil say if you have a leadership role in business, encourage people. So you are our business leader on this panel.
Yes, and I encourage everybody to go out and get vaccinated. Actually, the Chamber is working on a vaccination campaign incorporating our business community as well. More to see on that. But I love Barry's sentiments today. Let's go out and have fun. And I love to hear that from the chairman of our Board of Health. Right on, Barry, that is correct. And we encourage folks to go out and support our local businesses. Certainly, if there is anything that the Chamber can assist with, that is what we are here for. So certainly reach out at any time. looking forward to seeing you out at our local businesses soon. So thank you.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. Matt Muratore, we've been at this now 99 times. Little did we know when we were planning that we would reach number 100 on Wednesday, May 26th,
Right.
days before May 29th, when you at the state level have made some changes. What do you think?
Well, Steve, it's amazing we've come this far, and I share the sentiments that Amy has just brought out about Dr. Potvin. That's probably the best news since I've heard since March 13 of 2020, to hear the chairman and physician of the Board of Health say that let's go out and have fun now. Seriously though, it's almost like, okay, so somebody else is saying that it's okay to do that. So it is, but it's great. It took so many people. It took your leadership, Steve, to do this and get all these guests together, and Ken with his leadership in the town, and really, as we've talked in the past, getting the communication out to people, getting the right communication out to people. And I think Plymouth has done a very good job because of all the leaders that we see on this every week after week after week. So. And again, none of this could have been done without PAC TV. So we are great appreciation for what they've done and what they continue to do for the community. So I'm just going to end with my PCA that I've started. Don't relax until you get the vax. We'll see you next week, Steve.
Thank you. Our local state representative, Matthew Muratore, again. Next week will be our final show. Lots of special guests. And at this time, we're going to go back to Ken Tavares, as we do each week. Ken, what would be a takeaway today?
Steve, there are a number of takeaways as far as I'm concerned, and it starts with Dr. Potvin and the Board of Health working so hard to get, along with our delegation, to get the site at Kingston opened up. It's still necessary. They persevered, and I offer my personal thanks for that site now being designated. I also agree with the comments that are made about being vigilant. We have responsibilities to do that, and I'm sure we will. It's wonderful to hear us now talking close to 15 months, doing what we've been doing, is that we can have fun. We can start thinking about things that are normal, that are uplifting, and I know that's going to happen. I also encourage people that are not working to take jobs, even if they're part-time jobs. Help our businesses open up. This is not the time to sit home. This is the time to get out and assist those businesses. To hear businesses say that they're pleased that the doors are open is major. It took the actions of so many people to do that, and I am personally feel indebted to so many people that worked on all of this for over a year. We have done it, and we're getting close to it. So, many blessings to those that have worked so hard to keep Plymouth safe and open. It is happening. Thank you, Steve.
Thank you, Ken Tavares. And Ken is the immediate past chair of the Plymouth Select Board. He's been with us throughout, over the past year for all of these presentations. And at this time, again, like to encourage all of you to join us for our final Plymouth COVID-19 update next Wednesday here at noon at PAC TV Studios, 4 Collins Ave. Again, great thanks to Julie, the Executive Director here at PAC TV, Donna Rodriguez, who's here in studio, floor manager, and all of the many other people that work with us. Next week, we're also going to be rolling the credits, not only for all who have supported us at PAC TV, but all of the over 100 panelists that have joined us over 100 on the 100 presentations that we've had. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and see you next week.
Bye.
Hi, everybody.
Have a good day.
Thank you, everyone.